this little video snippet, we want to talk about how to help a patient who has unilateral involvement move to a bed that's high. So we might think about doctor's offices in this case, that there's these higher beds, the patient's in a wheelchair and has difficulty getting up on a high bed when they've got unilateral involvement. So the first thing we need to plan for is which is their involved side and which is their strong side. We always follow our rules if we can. So the rule for unilateral involvement is we always move toward the strong side. So based on how we've got our patient positioned right now, this is going to be his involved side and his right side is going to be the strong side. So we're going to get him positioned and we're going to use the help of a step stool so that he can get up there, and also we'll need the use of a cane or a helper of some sort. So what we're going to do with our patient Connor, say hi Connor, how we doing?
Good.
Awesome. So I know that you need to get up here on this high bed, that you've been having troubles doing that.
Okay.
So we want to just help you with that a little bit. So first of all, this is your strong leg, so we probably can use this leg to move this leg off the wheelchair. Can you do that for me? So we'll get the leg out of the way, footrest, and we probably wouldn't even have that footrest on. Okay, so Connor, go ahead. I'm going to have you scooch forward. I know you've been practicing that for me. Love it. Okay, so remind ourselves of what are the rules when we're doing a transfer. That we're going to put our foot on the inside and do a single knee block transfer and then bring him up to that standing position. So I want to get my bench as close as I can. I'm going to stick my leg inside there and say, Connor, on the count of 3, we're going to come to a full stand position. You can push right here on your wheelchair or here on the bed, whatever's going to help you best. But on the count of 3, we're going to stand 1, 2, 3 up. Ready? 1, 2, 3 up. He comes up, and I make sure now that he's stable. You okay?
Yep.
So I've got my leg blocking. Make sure you can see this. I'm blocking his leg. And now for the first time ever, I'm going to break a rule. I'm going to unblock his strong leg, which is the leg I'm counting on, and I'm going to move over and block his involved leg. What I'm going to ask him to do, I'm going to say, Connor, I've got you. I want you to lean over, just pick your right leg up and step on that stool. Stand up, turn, and sit. There he is, up on the high bench. Now once he's here, he can scooch back. Perfect. When he comes off the high bench, I'm not going to have him use the stool. That's now a hazard for him. So we've got to get that stool out of the way. So if he has a helper with him, the helper can remove it. But if he doesn't have a helper, he can use a device such as a cane to manipulate it. So what he can do is use his strong leg, and he's going to wrap it around. There we go. So now you can use your heel. You're going to take this and you're going to stretch that way out there. And use your heel to push that right under. There you go. So we make an extension out of the cane for his leg, and he can manipulate that bench right out of the way. So if there's no one there to help him, we give him a way to do it. If not, then we ask him, we tell him, ask the person in the doctor's office, ask your granddaughter, ask whoever to help. Now when he gets ready to come off this high bench, we have a couple of things we should do. First of all, the rule is to go to the strong side. So one option would be to move the wheelchair all the way around. So when he comes off that bench, he's going to come down and come to his strong side. Turn and sit. Okay, let's go back where you were. But for whatever reason in our hospital room today or our doctor's office, we can't move. The only way that the wheelchair will fit in this room is to stay where it is. So now Connor's going to have to come down off this bench. As he comes down, as the PT, PTA, we've got to support that leg that we're counting on. So he comes down and we support it. Once he's standing, Connor, we gotta take the long way home. So we're gonna lead with this side and turn towards your wheelchair. Turn, turn, turn. We get out of the way, reach that hand across. Keep turning, keep turning, keep turning. And now lower yourself to sit. Perfect. So ideally, we put it over here, so he simply slides down, we block, and he sits. But if we have some issue where we can't, we follow the rule, and he turns, leading with that strong side until he's safe.